To address the issues facing Tennesseans today, from 10 News, this is Inside Tennessee.
Good morning and welcome to Inside Tennessee. I'm your moderator, Mark Salinger, filling in for John Becker this morning. This morning we feature two candidates who have ran against each other 2 times before. We're joined by Representative Eddie Smith, the Republican, and Gloria Johnson, the Democrat. Both are hoping to represent District 13 in the State House. Thank you so much for being here this morning.
Good morning.
Thanks
Glad to be here.
me.
The 13th District, of course, runs through Knoxville from north to south. We're also joined by a great panel. Susan Richardson-Williams runs her own PR firm and is a Republican, and Don Bosch runs his own law firm and is a Democrat. Thank you to everybody.
Good morning. Glad to have you this morning.
Well, let's get right to it with the questions for the candidates. You guys are both running against each other for the 3rd time now. Tell me, what is the biggest challenge facing District 13 right now, and why you are the better candidate to address that challenge? We'll start with you, Ms. Johnson.
Okay, well, I would say because right now the biggest topic from every doorstep that I step on is health care. And people are really concerned about affordable health care, what's going to happen when it comes to pre-existing conditions. People really overwhelmingly want Medicaid expansion now. And we've tried Medicaid expansion. We've had Governor Haslam's Insure Tennessee, which was also a good plan, work to push that. But right now we have a failure in our legislature to recognize that 66% of Tennesseans, both parties, want Medicaid expansion. They need health care. We've got rural hospitals closing. We've got people going without care. We're the #1 state in the country with rural hospital closures per capita, and we've got to do something about that.
Representative Smith, is healthcare also the top of your issues, or is
it is one of the things, but people are also talking a lot about the opioid epidemic, and especially when you look in Knox County, overdose deaths are increasing by about 41% for especially the age group of 16 to about 21. And it's been increasing in the district over that time as well. And then the third one that people have been talking a lot about is just continuing to bring better paying jobs to our community as our community continues to grow.
And I'd like to elaborate. When you're talking healthcare, you're talking about addressing the opioid epidemic.
Well, let's talk about that a little bit more. Yeah.
Let me talk about the study that just came out from Ohio, who their Republican governor opted to expand Medicaid, and they have drastically reduced their uninsured numbers. But the most staggering thing that, as Tennessee, that we should look at, of the folks participating in Ohio in Medicaid expansion, 96% of those with opiate issues got treatment. Can you imagine in Tennessee if 96% of those were able to get treatment? Amazing.
More than 220 people have already died this year in Knox County alone from suspected overdoses. Is treatment the option, or is it prevention, or is it, what is it?
All of those.
I think it's some of both. I mean, we've been doing a lot, especially as it relates to getting people treatment. But what we haven't been doing, or what I've been pushing for, is on the prevention side. I actually passed a bill this year to start recovery high schools, because if we know that if we can get a student that is addicted to a substance, they've gone through a recovery program, if we can get them into a recovery school based on the statistics, especially what we're seeing from other recovery schools, that about 98% of those students will graduate high school, and better than 88% will go on to a post-secondary education. So this has the potential to really just change the trajectory of a child's life and put them on a better path instead of a destructive path that they're on right
Eddie,
now.
I'm going to commend you for the recovery high school thought, because I do think that's a good idea. But I have to take issue at the comment that we're doing a good job and a better job when it comes to treatment, because we are not. And I can tell you, I live in the system and I see it every day, and I see the jail docs and I see the addicted every day, and I can tell you it is dramatically worse, not better, than it even was a year or two ago. And I think, to Gloria's point, that expanded health care for those that fall within certain parameters is really the only solution. And however we get there, and I think there's fair argument for both, how can you suggest that we're doing a better job with the treatment when mental health and rehab facilities are closing right and left in this state?
Well, you have to look at some of the other factors where we've been focusing. NAS births are down 36% in our county. So we're seeing less children being born addicted to substances. We're seeing remarkable improvements of treating women who are pregnant and getting them off of a substance instead of leaving them on, so that we have less children being born. We put $3.2 million, and I actually fought to get that funding for the safety center here so that we can address those people with mental health with wraparound services, so they're not just going into jail, back out, back into jail. Well, the recidivism rate of what we've seen so far, if you can get to 18%, you consider it a success, and the safety center is at 13% right now in recidivism. So we're seeing some positive steps of what we've been doing. We've just got to be doing more, and we actually put $6 million recurring into the budget to help with juvenile recovery. We actually had very few beds in this state for adolescents for recovery, and we've been increasing that, and we've actually increased the beds significantly in the last few years by putting money into the budget to help with that.
So part of the problem, though, with the recovery school bill, the way it's written, you've got 3 regional centers, and you're asking people who have drug and alcohol addictions to travel 3 to 5 hours a day to a school. And the reality is, look at what we've done right here in Knox County. The program I had, the satellite intervention program, was behavioral program, but usually close to 50% of my kids at times had alcohol and drug addiction issues. And so they did half their program at Helen Ross McNabb and half with Knox County schools. We can do a program within our own school systems, the schools who need it, without having this center that folks come to with an enormous travel time every single day.
Wasn't that just a pilot initially, the bill you passed on the recovery high school?
It was originally started as a pilot, but we actually wrote the bill, so it's no longer just 3 per region. Actually, any school system can start one, and that's the way we set it up, because we recognize the fact, and what we were hearing from superintendents is a lot of them wanted to. Now, what we're doing is we're taking our time working with Knox County Schools and the Metropolitan Drug Coalition, because we want to make sure that we set it up right. So one of the things that I focused on when I was pushing that bill is I wanted to get departments out of their silo thinking. The Department of Education and our educators, our school systems are great and experts at education, but then we have groups like Helen Ross McNabb and the Department of Mental Health and Substance Abuse, which are experts in mental health and substance abuse. I wanted those 2 entities to start talking across one another to bring the best practices, and that's what we're working on now. And I've actually talked with the Tennessee Organization of School Superintendents that's looking at how we're starting to set this up in Knox County to use as a template for taking it across the state.
We're going to take a quick break right there. We'll be right back. We'll talk a little bit more about the opioid epidemic and then touch on a bunch of other different topics that we also want to get your takes on.